Let us, without further ado, go straight to Jamie Jenkins, former head of health analysis at the ONS. That's the Office for National Statistics. Jamie, very good morning to you.
Good morning, Mike. London must be kind of buzzing at the moment.
Well, it certainly is. I mean, I don't know if I can say the same for Wales, but I have a great belief in the fact that this will be great for the entire nation of the United Kingdom of Great Britain and Northern Ireland. I know you might have a few recalcitrant Plaid Cymru types over there in Wales and a few SNP people up in Scotland, but by and large, people like winners and they love to see teams doing well.
Yeah, well, most of the people in Wales, Mike, they're either supporting Liverpool, Man United, Chelsea,
Right.
etc. So I never understood Welsh people who kind of they don't want England to win, but all the players who play for England play for the clubs they support. It just never
Yes.
made any sense to me.
I know it doesn't make any sense, never did. But I mean, this is one of those times when, because of the fact that it's the Euros and it's the final and it's 34 million people watching last night, you can't tell me some of them weren't in Wales.
Oh, of course not. And I think, Mike, you've been just talking about it as well. That we're having all these shots in the arm with a vaccine, but this is a good shot in the arm for the economy because this is going to get that feel-good factor for weeks. People are going to be out with the hospitality, and we just need some good news, don't we? We need something to kind of get the
Well, I think
country
so.
going
And it's
again.
like I say, I mean, if anyone's sitting around this morning looking miserable and thinking, well, you know what, I hate England, I hate the idea of England winning the Euros, and I'm just going to be miserable all day, well, more fool them. If I can't help you, I'm afraid you'll just have to go away and sit in a dark corner and mope.
Exactly, Mike. And I think we've got the final. It's going to be a tough game against Italy. I think they were kind of on the edge against Denmark last night, and hopefully they can finish the job off now because we've waited for a long time in the UK to get any team towards a European final or a world final.
Yeah.
So this is the time. And if they can't do it now, Mike, you're probably talking at least another 60 years before they get to
Yeah,
the final.
but even just getting there is a great thing, and I think I'm very proud of what they did last night. It was a bit jangly at times on the old nerves for a lot of people, and some people are still recovering from that. So I was talking to Chris Evans this morning, and he was like, "I was so stressed out," and he still is stressed out because he's going to be stressed out for the next game as well. But that's what it's all about. Football is a great kind of uniting sport, isn't it?
Yeah, and if we can get, I would imagine, Mike, if England do win the final on Sunday, it would be a nice finish to get Badil and Skinner and the Lightning Seeds out singing live in the stadium.
Yeah.
But I'm not sure if that's allowed a live concert with the current
Well, I
restrictions.
mean,
I'm
this
not
is the
sure.
other thing I was going to say. Julia was saying this, that she was up there last night and she said it was fantastic because it was like normality. It was like normal life. 60,000 people in the stadium. It might be 90 on Sunday. People walking up Wembley Way, hugging each other, kissing each other, waving flags. There was no social distancing, hardly any masks. Hello, this is what life is like.
Well, one of the things I've been saying for a while, we've forgotten the last year, Mike, is that when we're born, we're here to live our lives. We're not here to kind of lock ourselves away and stay behind the kind of closed doors. We've obviously had all these measures in the last year, but I've just hearing this morning with people talking about, oh, we can't unlock because all these risks of different variants are going to come in, and it normally comes from the independence age lot who are kind of doom and gloom merchants. But remember, Mike, this is a global pandemic, and why should the UK continue to kind of restrict our lives when the latest variant came from India anyway?
Well,
So
that's
it's
right.
not a case of the UK is going to cause all these variants. So you're right, Mike. We've got to get on with it, get on with our lives, get that feel good factor, and get this economy going again.
And I saw Sir Keir Starmer at Prime Minister's Questions yesterday, as I'm sure you did. I thought it was pathetic, when he started banging on about what's the Prime Minister going to do if 100,000 people a day are going to be infected. Well, there's no reason to believe that 100,000 people a day are going to be infected. You might as well pluck another figure out of the air and say, what are you going to do when 1 million people drop dead on the streets of Manchester? I mean, it means nothing.
Well, yeah, I think it's a strange one with the Labour Party, Mike, because in Wales with Mark Drakeford, back last year, they didn't even have masks at all in Wales.
Right.
They had them in England, and they said in Wales, oh, we're not quite sure on the science with it in Wales. Then we followed suit several months later. Keir Starmer has been calling for weeks to try to ease restrictions, and then Boris goes and does that. And then Keir Starmer's now saying, well, we need to keep masks going on. And God knows what's going to happen in Wales with regards to all these easing of restrictions. But I did notice, Mike, on Prime Minister's Questions, the Prime Minister and Keir Starmer kind of adopting your common sense approach. maybe you should have patented that.
Well,
And
I
you
mean,
could have charged them
they
for it.
both uttered the phrase, didn't they? I mean, absolutely disgraceful without giving me any credit whatsoever. You know, we are the home of common sense. We have been for the entire time that we've been here. But I'm pleased to see that they've at least recognised that that is what is required. But tell us what you've seen lately, because you've been tweeting quite a bit about the figures. We keep hearing all the time that, you know, there's a big increase in the number of infections. We keep hearing that many more children are being sent home from schools. There's something going on, but I'm not sure that it's anything to worry about particularly.
So basically, Mike, if you think of the virus, this new variant that came around and it started rising in the northwest, and it was kind of concentrated in the northwest, and then it's doing what viruses do. It's just spreading out across the country. So rates have been going up. When you see these rates going up every single day, it's not a case of things are getting worse and worse and worse in the specific areas. They are worsening, but it's generally what you find is there's more cases in the country because the virus is spreading out across the country.
Yeah.
So most parts of the country, apart from bits of Devon and the bits of East Anglia, have seen kind of big rises in the kind of number of infections. But nearly all the rises might have been in young people 10 to 19, 20 to 29. And we've seen very little rise in the older age groups. We're starting to see a little bit of a rise there. But, Mike, this is a virus. Naturally, it's going to spread around. So we've got the vaccine in now. And I've been tracking the data, looking at kind of the deaths and the hospitalizations and the cases. And, I know we saw Chris Whitty and Patrick Vallance on the other day talking about the break of the vaccine and these different things that are going on. And it's quite clear in the data that is happening. Now, I wrote a blog a few weeks back, Mike, saying we're going to have to learn to live with the virus. I'm not going to take any credit for Boris reading my own blog, probably didn't, but he's coming out and saying we need to learn to live with the virus. And sadly, Mike, that's going to come, as I think was discussed by the Prime Minister today, a rise in deaths. But deaths at the moment are at relatively low levels.
Yeah.
And we've still got at the moment, Mike, 10 times more deaths in the UK linked to flu and pneumonia than we are with COVID. But we don't get that shoved down our throats every single day on the television about how many people have died from this, how many people have died from that. They are at relatively low levels. I expect deaths will go up. But to put the figures, Mike, into context, because people are talking about rising hospitalizations. At the moment, if you look at all the beds in England, about 1.3% of them have got COVID patients in.
Yeah.
At the heart of the winter, it was over 30%. So,
Right.
we've got a massive long way to go before we get anywhere near what we had in the winter.
But isn't it interesting that you say that? And when you hear these stark numbers that you're so good at showing us, Jamie, we were being led to believe that 90% of the beds were being occupied by COVID patients back in January. And even at its peak, it was only 30%. It tells you what's wrong with the NHS, is that they can't organise it properly.
Well, the NHS is a big of a story in itself. I was looking at the figures, just reminding myself about departmental budgets. So we've got over £171 billion is given to the Department of Health and Social Care. That's a huge budget.
Yeah, massive.
There's money then spent by the Welsh government, Scottish governments, because it's given direct to their health services. We've got this huge cost to the NHS. And remember now, we still had massive waiting lists in the NHS before the pandemic, Mike. And I heard you talking the other day about charging to go and see a GP.
Yeah.
And people are all in shock and saying, oh, we can't do that. It's free at the point of delivery. But one thing that's never talked about, Mike, is dentistry.
Yes.
Everybody's happy to go and pay to see a dentist if you can get to see.
I mean, I can't remember the last time I didn't pay. I mean, I've given up on NHS dentistry, by the way, because they told me basically pretty much flat out they couldn't help me. I should go private. So I did anyway, which is a lot more expensive, but it's a lot more reliable, and it's a lot quicker, and it's a lot better.
Exactly. And the thing, Mike, if you've got 171 billion spent on the NHS and you've got all of these waiting lists, which were still massive before the pandemic, it's quite clear that Sajid Javid, as the new health secretary, has got a massive thing to sort out here, because we're already borrowing money in the country, Mike, to pay for this NHS. So we don't even get enough tax to pay for it. Something needs to change. You can't continue with doing the same thing. That's what they call madness, isn't it? If you can't continue to do the same thing as we've done in the past. So we're happy to pay for NHS dentistry, or if you can get to see an NHS dentistry. So I think the model, and you've been highlighting it, Mike, as well, which is kind of shocking, is the GP model where you get paid for the number of patients rather than the number of people you actually see. Well, that's not an incentive to see for GPs to see patients.
No, it really isn't. And the point is that, as we look at these statistics, we should be encouraged, should we not, that the number of infections is going up. They call it cases. I don't call it cases. I call it positive tests. But the number of so-called infections is going up. but the numbers of people going into hospital is not rising at the same rate. Therefore, most of the infections, therefore, you can conclude, are not very serious.
And that's the critical thing here, Mike, because if you remember when we locked the country down last March and we did it in the winter, it was to protect the NHS, is what they were saying, and that's not what we're seeing at the moment.
Well, that was the first excuse, wasn't it?
Well, yeah, protect the NHS and some numbers, Mike. So some tragic numbers. All this, all the positivity about England and the football, but some tragic numbers. So, some journalists in Wales have done like freedom of information requests around all the health boards in Wales, and it's been kind of covered on the stories in Wales this week. Is that we've talked in the past, Mike, about patients going into hospital without COVID, and then they catch COVID within there. In Wales, it's about over 7,000 patients in total, but what we've got now in Wales, and I think we've seen some similar figures to England published by The Guardian a few months back, I think. But in Wales, 1,860 of those 7,100 patients actually caught the virus in hospital, Mike. They never came out and actually died,
yes.
Having caught the virus in the hospital. So we're talking about protecting the NHS. Well, the NHS wasn't very good at protecting them, were they?
Absolutely right. Stay with us, Jamie, for a moment. We're going to take a little short break. Jamie Jenkins with us. He is, of course, former head of health analysis at the ONS. He's got some great figures which are very revealing, all about where we are and where we are going. This is Talk Radio.
On Talk Radio.
Welcome back to the Independent Republican, Mike Graham, right here on Talk Radio. We're talking to Jamie Jenkins, former head of health analysis at the ONS. Jamie, let me ask you about Grant Shapps. He's going to be getting up in the House of Commons in about an hour's time, we think, to give us the latest on the travel business, on testing on return from holidays, on what they will say to people who are double jabbed, that they may be able to come back and not have to quarantine. But it's a big problem, this, still, for a lot of people, as far as organising holidays, as far as booking holidays, as far as, because the numbers that this country has provided to the world have actually damaged our ability to go anywhere.
Well, that's bang on, Mike. We're testing far more than some similar nations across Europe, for example. And when you're testing a lot more people, you do identify more cases. We are seeing a underlying rise, because if you take the number of tests and the percentage of those tests coming back positive or going out, but we're sending alarm signals across the world. The problem I have with the kind of these travel restrictions, Mike, and people are talking about, oh, it's okay, stay at home and staycations and things. It kind of starts getting into this kind of wealth divide, because there's many people who are kind of on low incomes who obviously want to holiday themselves. They can't afford to holiday in this country because there's the cost has gone up, when people are making money back on the businesses. It's a supply and demand model. People will charge more, people want to demand more. But, if you can't afford these holidays in this country, what are you going to do? So I think if you've been double jabbed, or if you've got kind of you've positive tests or negative tests have been shown, going abroad we need to start opening up some travel.
Yeah.
And looking at these countries, we don't want to risk, say, another variant coming in, but all the vaccine.
Yeah, but let's face it, Jamie, it's going to happen anyway. I mean, I think they've got to change the way. I mean, I was quite pleased with Boris this week when he appeared to change his view and his approach on dealing with COVID. Rather than saying, oh, we have to hide every time we get a new variant, he was basically saying, look, we have to do this at some point. We have to open up the economy at some point. Let's do it now, because we've got the school holidays coming up. Let's actually learn to live with it instead of running away from it all the time.
Exactly, Mike, bang on, because we've got flu variants that happen all the time, and we haven't kind of hidden away and stopped traveling over the last kind of 50, 60 years because of all of that. And the testing thing you was talking to Julia about, in the UK at the moment, we're testing about 1 million people a day, and this is a huge number. Right. So why don't we just allow some of that testing capacity to go towards people traveling back from holiday? It's a scandal that they're charging people to kind of go about living. You could say having a holiday is part of normal life.
Yeah,
so if the government's restricting you to do that, make it easier, have the testing when you come back. And if you've been double jabbed, well, what's the point of the vaccine if you can't go about your own daily life and going on holiday?
And also the other point that Starmer was making yesterday about, what's he going to do, the Prime Minister, about all these people who are going to be self-isolating. Well, you're only self-isolating because this ridiculous app tells you to, or because you've been pinged because you might have been near somebody who might have had COVID. The whole thing is a nonsense, it seems to me. They could easily do away with all of it.
Well, this self-isolation thing, people are getting pinged and they're not even quite sure why they've been pinged. But if you've had, say, the vaccine and 2 vaccines, why are we kind of self-isolating? Yeah. And I know people in the NHS who are self-isolated at home, which obviously this isn't going to help get these waiting lists down. They're testing negative, but they've been told, but you've got to self-isolate because of the app. And it just makes no sense whatsoever, Mike. And I think, hopefully Grant Shapps will offer some optimism in terms of where we can go and travel. Because remember, this time last year, where there were no vaccines, you could go anywhere you wanted.
Yeah, exactly.
So, what's changed?
Well, I mean, it's all changed for the better, but except it hasn't changed the way that we can do things. Jamie, really appreciate talking to you. Thanks very much indeed. Jamie Jenkins, former head of health analysis at the ONS. This whole business of isolating is a nonsense. The only reason people are isolating is because we're doing so many tests. The only reason we're doing so many tests is because the government keeps saying we have to keep testing people. But it's not actually doing anything. It's not actually doing any good. And it certainly isn't stopping the rise in positive tests. In fact, if anything, it's encouraging the rise in positive tests, which they call cases, which they then mean we are heading for some kind of disaster in the summer. I mean, Keir Starmer's fallen for it, so it must be rubbish. Let's get some news headlines.